ladies and gentlemen, one thing about COVID-19, it don't discriminate as far as who it hits. In Massachusetts, they are getting a surge of cases in the most educated and affluent neighborhoods there. So this came out in the Washington Post May 1st, 2020. In educated and affluent Massachusetts, coronavirus cases surged. The decline has yet to come. So now they are seeing these cases skyrocket where people have, college degrees and they live in affluent parts of Massachusetts. And right now, Massachusetts has the third largest number of coronavirus cases in the country, and it has the fourth highest death toll in the US. And despite predictions that numbers would be falling by now, after a month and a half of people staying home, new cases counts have instead remained stubbornly high. The state's struggle to combat coronavirus reflects what a major adversary it really is, even for a place that has a lot going for itself. The toll has been severe and it is growing by the day. A lot of times people in these affluent neighborhoods, they tend to travel more. These are your type of people that will go and venture out more and travel more, whether it's for personal reasons or traveling for their jobs. These are the kind of neighborhoods they would live in, a more affluent neighborhood. As of Friday, Massachusetts had more than 64,000 cases, behind only New York and New Jersey. Its larger northeastern neighbors. The new cases totaled 2,106, continuing a dismal streak, lasting more than 2 weeks of at least 1,500 additional cases per day. Deaths hit at 3,716, behind only New York and New Jersey and Michigan. Even as states begin opening up their economies Friday, allowing restaurants, shopping malls, hair salons to do business that remained a distant prospect in Massachusetts. Instead, Governor Charlie Baker on Friday was announcing new restrictions, including a requirement that people wear masks while in public. Wow, they should have been start doing that. It's going to be a way of life, Baker said. No ifs, ands, or buts, no doubts. Mm-mm-mm. The persistence in which people keep getting sick in Massachusetts has been matched in other hard hitting states. Rather than, so they're not seeing any declines, you know, in their numbers. Instead, they're talking about other places like Illinois, California, and DC, where they're claiming that it's leveling off. But you know what? They keep making these claims that it's peaked, it's leveled off. And as soon as they come out in the media, if you notice, every time they come out in the media and say it's slowing down, the next day it peaks, it jumps up real high again. So I don't even pay attention to them saying that. I guess maybe they think if they keep saying it, it's going to happen. Well, that sounds very childish, but okay. Experts say this is expected, even if it means a long road ahead. Now, where I am, y'all, it is warming up. It's warming up. And it's already been warm in parts of the South. It's not slowing up. I don't think they're going to get the results they're looking for. If social distancing is done well, and Massachusetts has done it pretty well, the effect is going to be flattened. the curb. Okay, whatever. Another term they love saying, and I don't see no flattening of any curve going on in America, but okay. Spread it out over more time. David Hammer, professor of global and health at Boston University, an infectious disease physician at Boston Medical Center. Instead of a peak, it is a prolonged plateau. It's going to be a gradual decline. Like other states, Massachusetts had avoided some of the most dire projections about how many people would fall ill. Its social distancing measures have prevented hospitals from becoming overwhelmed, but actually pushing down the rate rather than treading water will be tricky to pull off because of the nature of who is getting sick. More than half of the state deaths have been people in long term care facilities, yeah, nursing homes. Elderly make up a slightly higher share of Massachusetts population than the national average. And if you remember the 16 pages of obituary that I showed y'all on my live stream about 2 weeks ago, that was the Boston Globe. Essential workers who have to commute to their jobs each day and often are in close quarters with others also have been hit hard. And see, that's where Black people come in. A big bulk of the essential workers in America are Black people. That's why Black people are dying at higher rates because Black people are the ones doing the big bulk of essential jobs here. Some people have been able to completely shelter at home. Their risk of getting anything is very low indeed, said Jeffrey Griffith, who teaches public health at Tufts University. But there are other groups of people that man the gas stations, grocery stores, the hospitals. They're police and firefighters. They have to go to work. And then there are the poor, for whom social distancing at home is particularly challenging. That would be challenging for anybody. You don't have to be poor for that to be challenging. Come on, get out of here with that, y'all. Okay. And they're just talking about immigrant families that are living in 2-bedroom apartments or small apartments. They're at risk. If one person gets infected, the likelihood of everyone being infected is very high. There's no room for people to isolate. Immigrant groups say Massachusetts need to do a better job circulating information about coronavirus in multiple languages. Though much of the literature is translated into Spanish, that accounts for only 40% of the state's population that is not proficient in English. Okay. Apparently, they have a Haitian community up there too. So that's why they're asking for more translations with the coronavirus information. Massachusetts was among the earliest states to reckon with coronavirus outbreak, recording its first case on February 1st. Okay, but Hamer said the virus was probably present far earlier and it was far more widespread than anyone knew when Baker declared the state of emergency on March 10th. So they said they saw their first case in February, but they believe it started even before then. Interesting. With everyone cooped up indoors for the New England winter, but without official mandates to social distance, the virus had ample opportunity to spread. Many of the cases from early March were tracked back to late February conference hosted by biotech company Biogen. Experts say that the state had done well with the response. Baker is a Republican, while Democrats dominate the legislature. The two sides have worked cooperatively with little partisan rancor. Okay. So, they're pretty much struggling like everybody else, but hey, they are the first state that said it's hitting the affluent people in the state a lot harder. I never heard this from any other state. So Massachusetts, by far the first state to admit that this thing is surging among the affluent and educated people within their state. But y'all, please tell me what you think. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you in the next video. Peace, family.